interesting. So the number of hospitals per patient is no longer as strong an indicator as the number of private medical practices, primary care physicians per 1,000 residents?
We have no data at all that tells us that suggests in any way that the number and location of hospital beds or hospitals has any association with public health outcomes. We have no reason to think that the number and location of hospital beds, number and location of emergency departments improves the public health one iota, whereas we have a mountain of evidence that suggests the number, location, and organization of primary care clinicians and practices is the major predictor of health outcomes of any medical service.
Dr. Fine, you've set some really stark figures on the table right here, talking about $1 trillion of wasted money every year going into the health insurance system, and whether that's going there from patients spending their private money, whether it's going there through the government implementation of resources. The bottom line is that it is going into the coffers of these insurance companies. That's where the money is going.
Well, it goes to insurance companies, it goes to hospitals, it goes to pharmaceutical companies, it goes to device manufacturers.
Nursing homes.
It goes to nursing homes, it goes to all sorts of middlemen, I suppose in 2017 I should say middle people, but it goes to all sorts of people who have nothing to do, who don't contribute one iota to improved health outcomes. When you look at the United States as a nation, we spend twice as much as the average of the other industrial nations, and that's average. But our health outcomes, our public health outcomes, rank us 37th to 58th in the world. It's like going to the supermarket and picking up a dozen eggs and getting to the checkout and having the dozen eggs go for $1. Getting to the checkout counter, having them charge you $2, and then opening up the egg box and find out that you only have 6 eggs and 1 or 2 of those are broken. We spend way more than any other nation, and our health outcomes rank us 37th to 58th in the world.